Bonjour à tous, bienvenue.
Hello, everyone, and welcome to this press conference to go over the COVID-19 situation in Quebec. The Premier of Quebec, Mr. François Legault, is together with the Minister of Health and Social Services, Ms. Danielle McCann, as well as the National Director of Public Health, Dr. Horacio Arruda. Mr. Premier. Yes, hello, everyone. Before starting, I wish to offer my sympathies in the name of all Quebecers to our friends from Nova Scotia who have experienced a horrible drama over the weekend. Our thoughts are with you, all people of Nova Scotia. I want to start with the numbers of the day. We have 62 new deaths for a total of 939. I wish to offer my condolences to all the families of these 62 new victims. And a special thought, too, for all the close ones of the family of Victoria Salvan, who was an orderly who died. She probably caught COVID-19 at work while trying to save people. So I wish to salute the memory of Victoria Salvan. We now have 19,319 confirmed cases. This is an increase of 962. We have 3,847 people who are cured amongst those 19,000. We have 1,169 people being hospitalized, an increase of 67, and of those, 198 people who are in ICU, an increase of 15. Our national emergency remains the situation in our CHSLDs, as well as our residences for the elderly, whether they be RPAs, RIs, all places where there are many vulnerable people. We are still, as I speak to you, we are still missing over 2,000 employees in these residences. We have about 100 doctors who added themselves to come and help out. Of course, we need a lot more than that. And I spoke on Saturday evening over the phone with the president of the Fédération des médecins spécialistes, because we need full-time people. That is what is important, to perhaps make sure that all specialist doctors understand full-time people, to avoid that there be too much coming in and out in each of the residences, and also to make sure that the habits can get used to working together day after day, that we don't end up changing specialist doctors every day. So, together with the Minister of Health, as well as the two presidents of the two doctors' federations, we have agreed that over the next 2 weeks, we will be limiting activities in hospitals to those that are urgent. So first, I want to reassure everyone. What this means is that those people who need treatment for cancer or for a heart problem that is urgent, those people will be receiving those treatments. So that is quite clear. Emergencies will keep being treated. However, everything that can be postponed will be, because the national emergency right now is to bring as many people as possible and as quickly as possible full-time in our residences and nursing homes. Right now, we have 4,000 people who are affected by COVID-19 in our residences. We have to take care of these people, and we're missing 2,000 people to do so and to be able to take care of those vulnerable people. So I request those doctors, and particularly those specialists, because right now, by canceling and delaying and postponing all activities, there should be people with availabilities. There are people who will be able to group up and give all emergent or emergencies to 1 or 2 people, which will free up everybody else to go to the elderly residences, and it is really important that we have more doctors who come for the full 2 weeks. When I'm saying full-time, it's full-time for 2 weeks until we take control over the situation again. I would also request doctors, nurses, and orderlies from areas that are not as affected, like here in Quebec City, to go to Montreal for 2 weeks in our residences. We need you. Our network is organized in such a way that there are CIS and CIUS for each region, but now we need more than ever to have collaboration. Apart from specialists, of course, if there are family doctors that can also give time, freeing themselves up of less urgent matters, please come to the residences. Up until now, we have 65 people from the Canadian Armed Forces who are in the CHSLDs. We are, of course, ready to welcome the following 60 as soon as they are available. We have started adding students as well, people who study in the health domain. They've started going to CHSLDs, and we have gone through once again the list on the Je Contribue site, and I do wish to bring a clarification. We realized that out of the 50,000 people who gave their name, there are same who gave their name 2, 3 times, 10 times in the different regions of Quebec. So there aren't 50,000 people who registered in the end. There's 19,000. And there's about 15,000 left that we are calling to be able to see their availabilities. But as I was saying for the doctors earlier on, we need people full-time. We don't want to have people who are going to come one day or half day. We really need full-time people in order to limit the number of people who go into the residences, and also to make sure that we can make all these people work together, that they get used to working together day after day, and that we have teams in all the different residences and nursing homes. One word now on protective material. I saw over the weekend that certain residences were saying that they didn't have enough protection material, personal protection material. There's no reason for that. We have enough protection material. We are, in fact, also starting to make our own gowns. There are some that have already started being delivered. The masks, well, you saw the announcement today with certain companies. We are making sure that we are starting to manufacture them ourselves. So there is no short-term problem with the protection material. Where we do have a problem is with certain medications, sedatives. Everywhere in the world, there is a scarcity. So we have similar products that we are using right now. We explain to people how to use them, those products that are similar.
Now,
unions. I have understood the comment of the unions over the weekend, and it is important. I repeat it. We should have done it earlier. I should have done it earlier. We have to find the means of increasing the wages of orderlies in a permanent way and as quickly as possible. So I have asked the president of the the Treasury Board to call the unions in tomorrow, so the CSN, the FTQ, amongst others, and to try together with the unions to fix as quickly as possible everything having to do with the wages of orderlies. Ideally, it would be to fix this problem together with the unions and to do so quickly. Now, over the weekend, I spoke with a lot of people. And I know, and now I'm talking to Quebecers of all ages. Some of them are very tired of being at home. And I get it. I know that there are some who are tired of hearing about the elderly or the older people. I know myself, I'm 62, and I don't like to already be considered to be in that category, or if not, then soon. So we'll call us the wise ones. That's a suggestion of Dr. Ruda, to call us the wise or the not so young. It's beautiful out today. I would suggest to you, everyone who can do so, go outside at some point today. It's good for your spirits. I understand that you cannot remain confined. The only thing that you have to try to do, and that has to be done, is to stay 2 meters away from anybody else. And when you come back in, you wash your hands. But all people who are not as young, who are wiser, I would invite you to go outside. I know that there are some, unfortunately, who need to be accompanied by people. We're seeing what it is that we could do, perhaps with homemade masks. My daily thanks. I wish to thank, first of all those who were already working in the residences for the elderly and who really made sure that the services could continue being given in the course of the past few months. I wish to thank those who added themselves over the past few days, and I also wish to thank everybody who will be joining in the next few days. It is our national emergency right now. We have thousands of vulnerable people who are at risk in our residences for the elderly. They need help. They need medical staff of all sorts. And we have the duty to go help them. And I wish to give huge thanks to all those who will be joining those teams. So I will end by saying, let's not drop the ball. We will get through this together. I thank you. English?
Good afternoon. First, I would like to offer my condolence to the people of Nova Scotia for the terrible tragedy. My thoughts are with you. Last week, I sounded the alarm about a national emergency in our senior residences. My goal is to stabilize the situation in every affected residence. That's why I have asked that all available physicians work full-time in the residences for the next 2 weeks. It will help us gain time and save the lives of our most vulnerable elderly. Finally, I ask every Quebecers to continue their efforts of physical distancing. We're doing what it takes to save lives. Thank you all.
Merci, Monsieur le Premier ministre.
Thank you, Mr. Premier. So we will now be starting with the question period.
Bonjour, Monsieur le Premier ministre, Madame McCann, Monsieur Arruda. Monsieur le Premier ministre,
Mr. Premier, you are inviting people, in fact, the staff of the regions that are not as affected and who work in the health sector there to come and help out in the Montreal region. What is planned for these people if ever they do decide to answer your call? Are there places where those people can live? We often say, that the devil is in the details. Have you already started a sort of structure to make sure that those people can be housed? Yes, we have planned for hotels to be able to house them, so people, doctors, nurses from Quebec City who would come and work in Montreal for 2 weeks, we will be putting them up in hotels. So we are going around everything again, but yes, we will be taking care of housing them.
Comment ça se fait, Monsieur Legault?
And how can it be, Mr. Legault, that we realize today that our health system is completely, I was going to say, disorganized by what is happening because we have to stop giving care in hospitals. We have a lack of staff, and we take staff from hospitals, sending them to CHSLDs, asking specialists to work in CHSLDs, etc. How is it that over the years we were not able to see something that is so huge as this come? You know, it's enough that there's one event, and I know that it's a big event and we've never had something like this before, but all the entire health system that we have been building for so long, it falls down like a pack of cards. We have the impression of being in that. Have we not been negligent? Well, first, we have the residences for the elderly, and on the other side, we have hospitals. We already had a hard time drawing people, attracting people to come and work in our residences. So we already had, despite the budget increases, we weren't able to fill the positions in those residences because it's very difficult to work them. So that is why it's so important to increase the wages. Now, we have about 6,000 people who are either infected or they are scared of being infected, and they are no longer working in the network. So about 4,000 in hospitals and 2,000 in residences. Why can we face a situation better in the hospital? Well, because we have postponed the surgeries and the activities that were not essential. So we have thousands of specialists, doctors, and the nurses who usually work together with those doctors who are available in the hospitals. We don't have that availability in CHSLDs. So what we're saying is for 2 months, we have delayed all the surgeries that were not urgent, that freed up beds in case we needed them. So we had 8,000. We only need about 1,000. So now there are people who are available, specialists and nurses who work together with the specialists, and we are redeploying them to CHSLDs. And why don't we have the same problems in the hospitals? Well, quite simply because we postponed the activities. Following question. A question from a colleague. You alluded to the needs in doctors as well as delaying urgent activities, but there are groups of doctors like the anesthesiologists, pulmonologists, and cardiologists say that this structure is putting in peril the lives of patients, and some fear that we'll be saving lives while sacrificing others. What are you answering to them? Well, listen, I explained it. And it's easy to scare people, but what we're saying is everything that is urgent, whether it be cardiologists, whether it be people who care for people who are ill of cancer or other serious diseases, those people continue giving the treatments that are urgent. So I understand that it's not natural to go work in CHSLDs for those people, but that's where we need them. And if you will allow me, Mr. Premier, we have 18,000 beds in Quebec in the hospital sector. There's about 7,000 that are free right now because we have postponed elective surgery. So there's 12,000 that are occupied by patients that we are caring for right now. So those are all the urgent situations. There's the emergency, there's the entire sector, as was saying the Premier, oncology, cancer, cardiology, and we're taking care of everything that is urgent and even semi-urgent. So, in fact, the situation remains the same, and it has since the beginning. Well, since the beginning of the crisis, I mean. We're not changing that. It is those activities that we have to continue in the hospital setting. But we do consider that there are members of the staff, doctors, who are inactive or freed up because of those 6,000 beds. Or 7,000 beds, because it varies a little. So those 7,000 beds that have been freed up because of elective surgeries. And what I wish to add about the question that you were asking, I wish to tell the population, and particularly the patients, the people who have chronic diseases, the people who have cancer or who have cardiac problems, call your doctor, call your specialist. That person is there for you. Those are not going to be coming in CHSLDs. Your doctor is there for you because what we've been hearing is that people are waiting. They're waiting too long before calling. they're waiting. They don't even go to the emergency ward if they have pain that is potentially linked to a cardiac problem, even a cardiac arrest problem. And I'm saying today that, yes, we are operating in. We're doing an operation in CHLDs which is temporary and necessary, but it does not affect everything that is urgent, semi-urgent, and could become urgent. We have teams that are following that every day, clinical teams. So I want to tell the population, do not hesitate and do call your doctor. Go to emergency, call the ambulance if you need it. Do not hesitate. Mr. Premier, I'd like to get back to your mea culpa of last week. You had said then that you should have increased the wages of the orderlies, even without the agreement of the unions. And yet the FTQ today says that when they filed the request on the 11th of December last, they had requested higher wages for the ones with the lowest wages, including the orderlies. So why was that not accepted, that modulated offer? Well, I was happy to hear the unions over the weekend say that they were open to it. So let's fix it then, if there's no problem. What I would like is for us to fix that problem of the wages of the orderlies. But I have heard certain union presidents say, yeah, but we would also need to increase the other groups. What we're talking about here are the orderlies, increasing their wages more than the other employee groups. If they agree with that, perfect. We're going to fix that very quickly.
Bonjour.
Hello. Mr. Premier, at war, the most important part is the information. Since the beginning, have you been able to get all the information that you should have had to be able to make the correct decisions? We don't have the impression. Yes, I think that we've had all the information. Of course, we worked with predictions. We thought that we would need 5,000, 7,000, 8,000 beds to welcome people affected by COVID-19 in hospitals. That did not take place. However, what did take place, and now we got the information as it came along, but remember the first moments, I told you, the worst thing that could happen to us is that COVID-19 comes into the nursing homes and residences for the elderly. That is why I was probably one of the very first to say we have to ban visits. We have to prevent COVID-19 from finding their way into the residences. But despite that, and later we'll be able to see why, it did go in as much, probably maybe through the employees that weren't always wearing the individual protective material that was necessary. But that is where there was a huge surprise, is to see 4,000 infected people in our residences. If somebody had told me that on the first day, I would have said, oh, come on. Dr. Arruda, you were at SARS, H1N1. The World Health Organization, for years, has been telling all governments that there is a risk of pandemic and to get ready for it. We can see that Canada and Quebec were not ready. Well, listen, I will perhaps, I'll answer your question, but first I just want to make sure that I'm answering a question that was asked by Mr. Bossé on Friday about how many patients who were infected came out alive of intensive care. I think you were the one who had asked me the question. It's 86 people who went through intensive care who came out, about an estimate. So there is a 14-15% death rate. That's what we were expecting when people are ill and are hospitalized. So listen, that's always a very important question. What you are raising, we had reserves for the pandemic. Antivirals, for example, N95 masks, etc. There are decisions that are made by governments, by authorities, and this kind of pandemic, notably, has very specific characteristics together with the fact that people are asymptomatic before being able to give the disease. It's always easy in hindsight to say we weren't ready. I mean, you're saying if we had known, had we had, companies in Quebec to be able to create masks and make masks for us, we would have better reserves, would we have better management structure, better equipment in our CHSLDs? The answer, in hindsight, clearly is yes. But I think that we are everywhere in the world, we did end up in about the same situation. Perhaps, for example, China, with its capacity of producing masks in its own companies, it's different from what we have here. There are a lot of factors that will allow us to analyze things later. But I can tell you that we're doing better than what we've done before, faced with such a threat as this one, which is much greater than H1N1. And I can tell you that in H1N1, people reproached us that we had spent too much, that we had made a vaccine that wasn't necessarily useful, that it wasn't more serious than anything else, that we were throwing masks and antivirals by using them so greatly. So you imagine that these great threats require very important investments. And sometimes in the short term, what has to be done, the improvement of care, it's those choices that are made rather than stocking up for a pandemic. But following SARS, there probably will be an inquiry commission and people will have a look at it. And I have the impression that the governments will be more sensitive to the need to invest and to have a stock of materials. And I think that we might have a crisis together with the resistance to antibiotics, which is another threat that we've been talking about for eternity, forever. But these are choices that are not always easy for governments to have a balance between the short, mid, and long term. But I think that they'll be listening to us as far as prevention is concerned in the next weeks and months, so that we can give ourselves a balance back again after all this. Is it conceivable? Might it be considered to deconfine the wise, as you said, people who are 70 and over who are in good health? Is that a possibility? As I was saying earlier on, first, going for a walk 2 meters away from anybody else, go if you can. Now, what can we do with people accompanying them who might have masks? Well, we're having a look at all this, but I understand very well that these people are looking forward to being deconfined. And I would like to add as well, there's like two completely different situations. The residences for the elderly that are very infected and all the others, people who live in their own homes. Even though we may say the situation is going a lot better than we thought in hospitals, a lot better than we thought in society at large, if we exclude those residences for the elderly. And I would also like to add about Mr. Laforêt's question and the residences. What we're doing right now in those residences, there are things that will remain. Because when we're talking about dedicated teams, the first thing to do is to add staff. And that is what we are doing. Some of them are temporary staff, but we have to think right away about permanently adding staff in all residences, in all CHSLDs. So what we're doing, there are things, of course, that are going to be going through transition, but others are going to be continuing. And I think that it is important to say it, that we are experiencing a situation that is very difficult, but we'll do what has to be done in order for it not to happen again in the future, and that we give ourselves the conditions to be able to protect our people better. I would just like to add an element as well. It is excessively dramatic what is happening in CHSLDs, and to see our wise people die like this, it's very difficult. And I also wish to say that our experts, and we have experts that do scenarios for potential deconfinement, but also looking at what we've done. And we have saved tens of thousands of lives with the interventions of social distancing and confinement that we imposed. The estimate is between 40,000 and 50,000 deaths that we might have had if the virus had penetrated the population. It would have hit a lot more elderly people in RPAs, etc., and probably as well a lot of younger people who, unfortunately, it's rarer, but if there's a lot of virus circulating, the probability of having young people of 40 who die, like we had, these orderlies, it increases significantly. So I don't want us to have the impression that everything that we did not work. The 4th of May is in 2 weeks. Schools and all the staff would need to prepare to know whether they open or not. I don't know where you're at with what you're thinking about this? Well, in fact, we think we need a 2-week preparation period, and honestly, today we are not ready to announce an opening of the schools in 2 weeks. So you can draw your own conclusions from that. We are looking at what we could do in daycare centers, whether it be CPEs and others, or in schools as well. But precautions are required. 2 meters is required. So we need all sorts of precautionary measures that we're talking about with public health. But there is no question of reopening the schools in the short term. Thank you. I would prefer that you draw your own conclusions, Mr. Premier, about the reopening of the schools. When you say that you need a 2-week preparation period and you do not open a reopening, you're not announcing it now, should we understand that it's at least a week that you're delaying it by? Well, the day that I'll be announced to you that we're opening the schools, it'll be in 2 weeks minimum. So today I'm not announcing that we are reopening the schools, but I cannot tell you when we'll be reopening them. We're having discussions. We're going through evaluations. The idea is to say we have to go gradually, even for health. Let's not even talk about the economy. Let's just talk about for health reasons. We have to go gradually. We are starting with businesses. We can't put everything at the same time in the fall. That would be risky health-wise. So we have to go gradually, whether it be on the business side, daycare centers, schools. That's what we're doing slowly. So for now, we're starting with businesses. Last week, you were telling us that there were 1,800 people missing in our CHSLDs, 1,800 people absent for all sorts of reasons. And since then, you have asked for help to a certain extent. Army staff, about 60. You said that you went through Je Contribue again. You are emptying the hospitals, and now there are workers. And now you're saying that there's 2,000 people missing. Are the reinforcements not working? Well, first, the 1,800 is now at 2,100 if we're just taking people absent from CHSLDs. We brought 65 people from the Canadian Armed Forces. We brought about 100 doctors full-time. When I'm saying 2,000, it's 2,000 full-time workers, as I was explaining to Diane Francaire on Saturday night. Maybe I wasn't clear. 2,000 full-time people, not 2,000 people who come a day a week. 2,000 full-timers, so 5 days a week. But for the time being, we're still missing 2,000, unfortunately. Despite reviewing Je Contribue, the specialists, the students, we're still missing 2,000 people. But there is potential, Mr. Premier, because we do have 2,195 students who have presented their candidacy. So, of course, that means that these are people who will come. These people are trained in health and social services, and we believe that we'll have even more than that because there's a pool of 17,000 people within that pool of students. So we'll train them, but we'll train them in an accelerated way because they are people who already have a good base. So I think that in the short term, with the doctors and with the other groups that we've been talking about, we will be able to answer that need and have better control over the situation. Students will also be staying over the summer, and some of them permanently, because in that there are graduates. And we agreed with the professional orders so that they be accepted, even though they haven't finished entirely. And what I mean by the future, what I was saying earlier on, we won't be in the same situation as we were before the crisis. We're going to have potential for a labor force that we didn't used to have. We invested as a government close to 100 million with CHSLDs, and we weren't able to recruit all the people that we wished to recruit. But in that context, we probably will have people who will be interested in working with us. We have very good hopes that we'll be able to recruit and really adding staff, as we wish to do in the past. Also, there are 2 or 3 numbers in one day as well in terms of people. There's 2 or 3 work shifts, and people have to take days off as well because you can't continue for 45 days without having a day off or 2, because the more you're tired, the more you can make errors, etc. So all of this has to be taken into account because the problem is not going to be over tomorrow morning. This is going to last a few weeks and perhaps months.
Merci. Prochaine question, Hugo Lavallée, Radio-Canada.
Oui, bonjour. Donc, juste pour être bien certain,
Just to be sure, to understand these numbers, 2,100 absentees, minus 100 specialist doctors, that's 2,000, minus 65 military personnel. Now, we still are missing 1,935 people. I understand that there are not anybody from social economy enterprises that have started working or students. We're still at zero at that. And the people who come from different regions, it's not in those calculations either. I just want to make sure that I have a good portrait of what's going on. Social economy enterprises, and I'm launching a call because there's those people. There aren't many people right now. And I thank those who come and help us. But it's maybe, we have about 20. We really had hoped having at least 1,000, if not more. So these are people who are trained. And I'm calling to them again so that they come and join us, because these people we don't even need to train because they know what has to be done in terms of tasks. I also spoke about the students, but the students, we're going to have to train them in an accelerated way. So I would say that over the next few days, we will be training them, and they could come in within the next few days to help us out. And that is why the specialists can come very quickly. There's general practitioners in there as well. We have 164 doctors who came yesterday to help us out, and I believe that there could be more. As the Premier was saying, we need full-time people. That is what we require, and that they create teams, a little bit like the Army did. There are 5 teams of 13. They arrived in 5 CHSLDs who really, really appreciated that, and that's what we're getting organized right now, full-time people. So I think that we'll be able to have the sufficient number of people to be able to get there in the short term. So concerning the difficulty in recruiting specialist doctors, I was reading the note that was sent by the Ministry of Health and Social Services in the past few hours, where, and this is an extra, doctors are contacted to invite the Order of Professional Services, the regional managers or the medical coordinators in the reassignment of their establishment. Local list of reassignment are established to ease the pairing. An interactive software was set up, and now we're talking about training and matching. End of the quote. It does seem to be a fairly complex process. Wouldn't there be a way of simplifying that process a little bit on the one hand, and on the other, that difficulty in recruitment, could it not partly be explained by certain bureaucratic heaviness within the ministry? I asked myself all those questions over a good part of the weekend. What has to be understood is that our network is divided up in 6 CIUS. In Quebec, there are CIS and there are CIUS, so it depends on the regions. It's more complicated in Montreal because there's many, and there's the CHU on top of that, so it can happen that a person be available, but that there not be needs in those CHSLDs of that person's CIS, but that there are needs in the CIS next door in Montreal. So that is why the system, that whether we want it or not, is a bit more complex. Ideally, we want to make sure, first of all, that doctors who work at the hospital in a territory, that the CIS takes those doctors, sent them to a CHSLD of the same territory. That's the easy part. The difficult part is when we take, for example, the Saint-Justin hospital that needs that available doctors go. Well, what CIS do we send them to? What CHSLD? That's where it becomes complex. And I admit that that is what we have to continue working on in detail. What I asked, in fact, is to say, well, we have 2,600 residences. What are the needs in each of those 2,600 residences? And let's take the specialist doctors and let's try to send them in those 2,600 residences, regardless what territory they belong to. And also, it does look complex, but it's known. It's known. The doctors know them. The specialist doctors, the director of the professional orders, they already know that there's already lists. There's, a reassignment group. Mechanisms have been there since the beginning of the pandemic. The regional medicine head, that's all known. So it should be done pretty easily, regardless. And I would have to say that, yes, we know what the regions that are the most affected are. Montreal, Laval, Montérégie. There are experiences even more. There is help that comes from our CHU as well. For example, the McGill Hospital Centre, which is helping out right now, the CHSLD with the west side of Montreal that has many CHSLDs. So they sent doctors. Saint-Justine as well, which is helping out CHSLDs. Many doctors who left from Saint-Justine Hospital to help out. So I think that tomorrow, the day after tomorrow, we'll have more doctors. Once again, I hope full-time. Thank you.
Bonjour, bon lundi à vous trois. Monsieur Legault, le comité...
Mr. Legault, the expert committee on crisis management in CHSLDs that you created is reproaching to not heed the recommendations by asking specialist doctors to go help out in the resources for the elderly, and now you're calling out to them again. What are you going to do to regain the confidence of the members of this committee, to prove to them that they're not just part of a public relations exercise? And I quote one of the members of the committee when I say that. Well, I would like for the expert committee to suggest to me other solutions. I am a guy who likes results. I'm a guy who's pragmatic. I'm all for experts telling us that it's not ideal to send doctors in CHSLDs, and we quite agree with that. What do you propose then? Because we all agree that this is not the ideal to be able to answer the needs in CHSLDs, to send specialists in CHSLDs. But if we don't have, for the time being, that many other people, to not say nobody, well, who are they proposing that we can send to CHSLDs? And what I would like to add as well as a complement to that is that we are going to have more links with that committee. And as of tomorrow, Ms. Blaine and myself, we are having an exchange with Dr. Nguyen, who is the president of the expert committee. And it is really in that sense that they can, such as what we said during the launch of the expert group, they can really give us recommendations. We'll be very attentive. We have been since the very beginning. But right now we are in an emergency, and we have to truly resolve problems in the very short term. So we're listening, and we'll hear anything that they had to say to us, and they will be emitting recommendations to us. After Ottawa, Montreal also recommends using masks. The director, Dr. Drouin, even showed up with a mask at her press conference on Thursday last. Mr. Legault, you have just talked about the question of homemade masks. You're saying that daycares may open before schools soon. In that context, are you still comfortable with the position of Dr. Arruda's teams who do not, for the time, recommend using the mask? Well, first, let's repeat what Dr. Arruda has been saying since the beginning. We cannot give people a false feeling of security with a mask. It is very important to keep the distance of 2 meters and to wash your hands with soap regularly. That is what Dr. Arruda said. He never said he was against masks. Second thing, for the time being, we need the masks for medical staff. As long as we have not succeeded, and we're working very hard at it, in manufacturing our own masks for the entire population, well, we can talk about it forever, but those masks don't exist. They're not available. So it's a little difficult to advise to people to wear them. I alluded earlier on to homemade masks. Can homemade masks be of any use? Yes, but they're not ideal. So it is part of the discussions that we are having together in order to, amongst others, reopen daycare centers, schools. Could it be part of the solution? Perhaps. Perhaps. But we are having those discussions right now. And if you allow me, Mr. Premier, people have the impression that I'm against masks, and I would like to be quite clear about that. I've never been against the masks. I just want people to know what a mask brings and why you use them and how you use them. The teams right now are having a look at all that, and there is literature that is starting to show that perhaps wearing a mask could be a contributive element to the reduction of epidemiology, but it has to be done adequately. So somebody who wears a mask, for example, a homemade mask, there are sorts of people who say you can take a T-shirt, and I mean a T-shirt, it can be very thin, and in terms of protection, it's not very high. But we're having a look at that. Over the week, we're going to have a new position about masks for people to be able to make themselves masks with certain conditions that have to be adequate. But I have to tell you that if we see, like we see in the United States, people, when they're waiting to go to the grocery store, here, people have no mask and are 2 meters away from one another. But if people start wearing masks and now they start getting with, a foot away from other people, like you see elsewhere, well, the masks, it gives you the impression that I'm a Superman, I'm being protected, I'm not going to wash my hands anymore, and etc. Well, it becomes dangerous. But if people, to protect others, or perhaps to avoid that they contaminate others because they are asymptomatic, if they wear a mask adequately and they follow the other guidelines, it'll be adequate. We'll probably even make videos to explain to people how to put it on, how to remove it, etc. Because even in a healthcare setting, sometimes people make mistakes. So I'm not against masks. I don't want people to think that I'm against masks. And, I'm telling you, wearing a mask all day, you'll see that you're going to be out of breath when you go up or down the stairs. But if a mask makes that people come closer thinking that they are protected, or because they're wearing a mask and gloves and now they can touch everything, I'm sorry, but now we are truly asking for problems. And everybody guarantees that the efficacy of masks is not guaranteed. It can even be harmful. But if we do it well, we'll do it. And I'm not going to start telling people, hey, you're wearing a mask, that's not adequate. No. But we really have to correct the perception that people have, that we've always said, no, first of all, we haven't. And the other, as we said, we don't have enough for everybody, so we're going to use them for those who truly need them. However, homemade masks will even give you the best fabric, the best elements to be able to make them yourself, yes. All right, last question in French.
Monsieur
Legault, you announced important measures to stop the spread of coronavirus in CHSLDs, where they were thinking about the inspection of all the residences for the elderly, which basically wasn't done everywhere after. You called in for reinforcements to help in CHSLDs, and some are still waiting for those. What do you think about how heavy this machine is in front of you to be able to respond to the present crisis? What observations? I don't think that the important problem is how heavy the bureaucracy is. I think that the main problem is that we are missing people in CHSLDs. We don't have enough hands. And yes, it's difficult to bring people in residences where the situation is very hard. When we say that there are 4,000 people who are contaminated, who are infected, who have COVID-19, I can very well understand that humanly, there aren't many people who feel like going to work in the residences. But the problem is there. Should we have thought about it ahead of time, the scarcity of staff following COVID-19 in CHSLDs? Maybe. But for me, the main problem right now is finding hands, finding people who have the qualifications, who have the medical knowledge, who know how to wear a mask, who know that gloves, when you go from one patient to another, they have to be changed, etc., etc. That is where we're missing people, and that is where we have a scarcity. So even with zero bureaucracy, if you don't have those 2,000 people to go and work in CHSLDs, well, you can't make them up and bring them from thin air. And it also has to be said that the CIS and the CIUS, and I think particularly in the Greater Montreal area, but elsewhere in Quebec as well, they have to now take care of situations that are taken care in the residences for autonomous people, the RPAs. And we hear a lot of CIS and CIUS who are coming to help RPAs because there's a lack of a breach of staff. There's been a situation where there were cases and the staff had to leave, and that is going on throughout Quebec, but particularly in the Greater Montreal area. And this is happening pretty regularly over the past few days, where it's the CIS and the CIUS who send their own staff to support the residents for the elderly. We've also seen private CHSLDs that we've helped out a lot. So There's 1,700 RPAs in Quebec, so that's huge work that is being done right now at different levels by the CIS and the CIS of Quebec, and there's also the intermediary resources, the IRs. And also another note, when we can make an analysis in hindsight, I'm sure that there's going to be commissions, but just to tell you that the agility of the network, you cannot imagine how quickly things are functioning right now. I think that people don't get all the work that is being done, people who are working night and day, even if it's just to go get material and equipment from another country in a context of international dearth. We've removed all sorts of administrative processes that are usually necessary when we sign contracts. We have developed software for investigations within 3 or 4 days, whereas usually you require a process that requires almost a year. So when we're talking about a complex network such as ours and agility, I can tell you I've rarely seen the system as agile it is being right now. So I think that, right now it's easy, and it's a very dynamic epidemic. Its portrait is changing right now. There are researchers who are looking at all that together in real time. We are truly in action-reaction mode. And I just wanted to mention that clearly so that people understand the work that is being done behind the scenes. You talked early on, Mr. Legault, about the schools. We understand that it is certainly not before mid-May that schools are going to be reopened. You put the emphasis more on daycares and emergency daycare services that could be broadened. When we go back to work and we don't have a daycare, what do we do with our children? Often we send them to the grandparents' home, and right now it's not possible. So are you going to broaden that? Clearly, the access to daycare to other workers, such as, and the success in daycare centers that have, up until now, they've been, it hasn't hit them. That is part of the things that we're looking to broaden the daycare centers for those workers that have to and can go back to work. That is part of the scenarios that we are examining right now. Thank you. We'll now switch to English questions.
Hi. We have heard from someone in Montreal who had symptoms and who went to get tested in Place des Festivals. He was told that they were not testing his age group. He's in his 50s. What's the situation right now? Who's getting tested? And do we still have enough tests?
In fact, if he has symptoms and it's not a criteria of age, he would have been tested. I would tell you that's the case actually with the prioritization. Unless is already somebody in his family was positive and gets exactly the same symptoms. But in fact, they are tested. It's what is recommended, actually.
So we should get tested. And do we have enough tests?
Yes, actually, we don't have any issues related to tests from what I know, even of coton ouaté or the Tage or the reactive. We have the capacity to do the tests, actually.
And what's the situation with schools in Quebec? The Parents' Committee of English Montreal School Board is asking to only reopen schools in September at earliest. What are the plans for the schools?
So far, we don't expect to reopen the schools for the next 2 weeks. But after that, we don't exclude any scenario. We're in discussion with public health.
Now, Katsane, CBC News.
Good afternoon to all of you. Premier Legault and Mrs. McCann, I have more or less the same question. Mr. Legault, when you said we still need 2,000 health workers in CHSLDs, I had an impression that I was going through the same press conferences than yesterday. So, like in the previous days, what do you say to Quebecers that have the impression right now that we're just going around and we're not progressing? And for Quebecers that have so much worries about not getting the healthcare they need, for example, people going through cancers, and you're basically saying that they do have access to the healthcare and the care they need. So if you want to.
First, if we look at the last 4 weeks, for the last 4 weeks, we had about 6,000 beds that were not used. Why was that? Because all non-urgent activities have been postponed. So what we say today is no difference with what happened in the last 4 weeks. What we say is that for the next 2 weeks, it'll be the same. We'll continue for cancer and other urgent services. Those one will be given, but the non-urgent one will be reported. Why is that? Because we need those people that we thought would work with people having the COVID-19 in hospitals. In fact, we didn't have more than 1,000 people that are using beds right now in hospital. We expected 8,000. So what we are doing now is ask those people, especially the physicians, the specialists, to come and work in our residences, all right? Maybe I wasn't clear enough last week when I said that, but those people, we need them full-time. I don't want to restart every day with a new physician in a new residence. I want them to come full-time for the next 2 weeks. So that's why I had a phone conversation with Diane Francaire Saturday night, telling her, hey, it wasn't maybe clear, I wasn't clear enough, we need full-time physicians in our residences. So I think now it's clear, and I hope in the next few days to get more physicians, especially specialists, coming to work full-time in residences.
It's the model that the Army is using. Like we have 65 people from the Army, and they have 5 teams of 13 people that go in 5 long-term facilities, and that's extremely helpful. So that's what we're doing with the people who are coming in, the doctors also who are coming in, and we have also students that will come in eventually, but we need people right now. And that's where we need the specialists to be full-time with some GPs also, but the GPs are already there as doctors who take care of long-term facilities. So we need those doctors to be organized and to be in a sufficient number full-time and to organize them in teams. And I want to also make a comment to your other, question that you had, that we want to reiterate, to really insist on the fact that everything that is urgent is being done in the hospitals. There's still 12,000 beds that are occupied in the hospitals of Quebec. And the emergencies are open, but also the physicians are there, the specialists in oncology, in the cardiac domain. They're there in other domain where you need to call your doctor. You have a chronic illness, call your doctor, and don't wait, and they will organize treatment for you. They're there for you. So I'm telling people not to wait when they need care.
Second question.
It's about the number of deaths in Quebec. Mr. Arruda, do you have still the impression that we're closer to the optimistic scenario? Well, now we're getting closer to basically Italy and the U.S. What do you think?
I don't think we're going to be like United States or U.S. or Italy, because the youth are not being as affected as those countries. But at the same time, the specific situation of CHSLDs is getting a high level of disease people. I hope that what is going on around Montreal, I would say in the metropolitan area, will not be the what we're going to observe in other places like Quebec and east of Quebec. I hope that the lessons, I hope that those territories who have not been attacked as in Montreal will I would say, will have the capacity to not repeat the problem we had with not enough people in staff. And that was a chronic situation before. And I think that it doesn't appear because we are focusing actually on CHSLDs and it's a terrible crisis, I believe. But we don't see the prevented cases that we did with the social distanciation because our healthcare system has not been stretched. It was what we planned and this, so that's the situation actually.
Thank you. Now, question sent by email by Raquel Fletcher, Global News. 2 global cameramen got kicked off hospital grounds today. Healthcare workers are afraid to talk to us. Are you trying to prevent the media from doing their job? Minister McCann?
No, I'm not aware of that situation. I'm going to look into it. No, we know that you need to do your job, so we will look into that situation.
Thank you. And the next question is, what are the scenarios for opening up the economy? Can you give us a best case and worst case scenario?
We're already opening construction and we're looking to gradually open the different businesses. At the same time, we want to see what are the results. So we're doing that with public health, but we'll do that gradually.
Thank you. Now,
Can I come back? Yeah. Sorry, on the question you asked me just before, that I just want to say that we'll look into it, but in the situation we're living, there might have been a problem because, you know, there's a lot of complexity in organizing the services, and maybe it was not the right moment or the right place. So I just want to mention this because, as we were saying previously, it's a very complex operation that we're doing in the hospitals right now.
Thank you. And now 2 questions sent by Phil Tim, Montreal Gazette. For Mr. Arruda, can you explain to us how many people in intensive care recover and what is the average stay?
In the day of average stay?
In intensive care.
I think it's around 5 days, if I do remember, and 86% of the cases that have been treated in intensive care recover, or at least get out from the intensive care. And I would say the mortality ratio is around 15%, which is what is expected in the literature.
And can you tell us what is the situation with the spread of the pandemic in the community outside of the CHSLD's network? How widespread is the virus? Is it essentially based in Montreal?
In fact, it's yes. I'm not telling that there is no cases elsewhere because there is cases, but not an active transmission. There is community transmission, but not as active as in around Montreal. Probably the R0 is lower than 1. It means that because, you know, the R0, and even there is new publications telling that the R0 was not from 2 to 3.4 like China says, but more 5 to 6 in United States. But that always depends on the conditions. But in Montreal, we are still having active transmission in the community. So it's why we want to be very careful, because if we go it too fast, it can come back, and then what we did will be cancelled by a too rapid reopening.
So thank you very much. Donc merci à vous trois. C'est ce qui complète.
Thank you to all 3. That completes this press conference. See you tomorrow.
Merci. Bonne semaine aussi.